Good evening. This is the virtual meeting of the North Andover Board of Health, Thursday, December 17th, 2020, 7 p.m. I'm Joe McCarthy, Board Chairman. I believe there is a quorum, but nevertheless, let me go through the roll call of the members of the board. Michelle Davis,
I am here.
Daphne Ever-LaFleur,
Hi.
Dr. Patrick Scanlon,
Present.
and also Dr. Max Tilson.
I'm here.
Also, there are members of the department that are in attendance, starting with Brian LaGrasse, he's the director.
I'm here, Joe.
Stephen Casey, inspector.
Yep.
And Tony Wolfenden, she's the administrative assistant.
I'm here.
So the meeting is called to order. First, a statement on virtual meetings, which has to be read. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their television by turning it to Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance or members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public who would like to participate, email your comments, questions prior to or during the meeting to blagrasse@northandoverma.gov. That is BLAGRASSE@northandoverma.gov. The question comment will be read during the proceedings and responded to accordingly. Approval of minutes from the meetings on October the 22nd and November the 19th. Michelle?
The meeting minutes from both October 22nd and November 19th have been reviewed and edited and are ready for approval.
Okay. Is there a second?
I'll second.
Okay. All those in favor say aye.
Aye.
Those
Aye.
opposed? Those opposed say no. The minutes are approved. Moving on to communication, announcement, and discussion. Obviously, the main, if not the sole topic of consideration is the COVID-19. And for that, I'm going to turn it over to Brian. Brian, it's all yours.
Thanks, Joe. Hi, everybody. Hope everybody's doing well. Haven't seen you guys in a few weeks. I'm sure you've all seen and heard about the spikes in the second wave. I'm sure you guys are seeing it at work. It's a post-Thanksgiving spike and upward trend that we're seeing right now. We're seeing literally 20 to 30 cases per day, new cases per day here in town. Now we're up to over 1,400 in total since March. So that's a pretty substantial number, and it's dramatically increasing. This past month has been kind of like the spring, where it's just inundated with cases every single day. So steadily increasing since our last meeting. I think last meeting we had 75 active cases in town. Now we've tripled that. We're over 230 active cases right now. So that's pretty substantial. Merrimack College only has 12 or 13 positives right now. They are now off campus for their winter break. The only ones that are there are some light faculty, staff, and I think the athletes are still there for their sporting practices and all that kind of stuff. So there's a small group of students still on campus, but it's nothing like it was prior to Thanksgiving. And it's not just us, it's Massachusetts in general. States across the country are seeing the exact same trend. Massachusetts saw yesterday that we 5,450 new cases yesterday and almost 5,000 today. And that's up to about a 6%, over 6% positive testing rate. I mean, we are doing over 100,000 tests a day in Massachusetts, which is really good. I think yesterday they did 125,000 tests. Hospitalizations have gone up since our last meeting. We're at the state is at about 1,800 patients in Mass right now, which back at the peak we were around 4,000. So we haven't quite maxed out like we did before. I think the age groups that we're seeing right now are completely different than what we saw in the past. Long-term care facilities are seeing an uptick as well, which is definitely concerning. We did a really good job keeping it at bay over the late spring and summer after their peak back in March and April. The deaths have been creeping up a little bit as well over the last month. Yesterday there was 71. I think today there was like 41. So we were averaging last month about 20 a day. Now that's definitely crept up and has gone beyond that. But for perspective, back in the spring, we were seeing 200 deaths a day. So like I said, the age groups are different that we're seeing. Hopefully it stays that way, aside from, obviously the uptick in long-term care. But I think with everything that they know and everything they can do with PPE and precautions, they will get better at it and hopefully kind of curb this last little spike. Last month, we were actually at a 1.3% positivity rate in North Andover. Now we're above 5. So we've definitely seen that go up as well. I think one of the things we've talked about in the past is obviously that the main concern is hospitals reaching capacity and being overwhelmed and not being able to handle the surge. Right here in the Northeast, we have about a 13% non-ICU bed availability and a 19% ICU bed availability still remaining. So we haven't maxed that out yet, which is good, and that's what we're trying to keep our eye on. But like I said, the biggest groups right now we're seeing is the 20 to 29. That's about 18% of our cases, followed by the 0 to 19, which is 17%. And then above that is the 30 to 39 age group at 16%. So before it was all of, over 80. Now it's all under 40 at this point. Not all, but the majority of our cases are under 40. The state has rolled back to phase 3, step 1. We were at step 2 for a little bit. Basically what that means is there's no indoor music performances. They added on some additional restaurant restrictions in terms of seating at tables down to 6 from 10. There's a 90-minute limit on your table. Gathering numbers have been reduced as well, indoor and outdoor gatherings. They did actually change the quarantine requirements as well since our last meeting, down to a 7, 10, or 14 day. And with those come different criteria. So if you were going to be a close contact in quarantine, you can test after day 5 of exposure. And if you're negative, you can be released on day 7, which I think is a really good step because the data that they were seeing was most people were contagious in the beginning versus the end, except if there was a really severe illness and they'd be contagious longer. Or you get sicker later. So 7 days is good. I think what they were trying to do is they're hoping that with the reduced quarantine timeline, more people would abide by it. I guess you can actually see the light at the end of the tunnel versus a 2-week, 14-day, mandated quarantine where people would just kind of blow it off. Because there's really no way to enforce it once they're out in the community and they're back home. We don't have the staff to go and patrol all the quarantines, obviously. So the next concern we have, obviously, is the upcoming holidays, Christmas, New Year's, things like that. As you guys all know, this virus transmits really well in indoor close contact environments. And that's exactly what Christmas and New Year's are. Same thing with Thanksgiving. So we've seen the post-Thanksgiving spike. I hope it doesn't spike again like this after Christmas. We put together some info to get out tomorrow and then again next week on safety for your gatherings, reducing your gatherings or not having gatherings, and then kind of giving people some information as to what they should be doing to protect their family. And then I'll let you guys talk about the vaccine because I know, Patrick, you are one of the first get it, so I want to hear all about it in detail. But as you guys know, we're rolling out the vaccine now. Phase 1 is the healthcare workers that are frontline workers dealing with COVID positive patients. And then it goes down to first responders and EMTs, PD, fire department, things like that. And then that goes on past that to your high risk, 65 plus. Then your K through 12 teachers, food workers, agriculture, transit workers, public works, public health, things like that. And then down to the general population of phase 3. So what we're hearing, and I hope they can, hold true to this, that December through February is going to be phase 1. February through April is going to be phase 2, and April through June is phase 3. I know Massachusetts is getting at least 300,000 doses by tomorrow that are being shipped out to other hospitals and being used and actually administered. So I'll let Pat talk about more about that, and I'll pass it off to Steve to talk about some of the stuff that he's been working on lately, and we will go from there.
All right. Thanks, Brian. So as far as what I've kind of been doing, and similar with Kalechi, our part-time inspector, who's been a huge help. We still have obviously inspections going on. Housing inspections are still kind of in full swing. Those are complaint-driven though. We had a beaver issue that was causing some flooding in a certain area, affecting a couple properties that we're still working on jointly with DPW and conservation. Mass complaints in general seem to have been down, which is good. But occasionally we'll get one pop up or complaints related to some of the guidance, whether it be restaurants or another business. So either myself or Kalechi has been responding to those. We've been getting a lot of calls too from residents, business owners, other people in town, just with concerns or questions that I've been trying to help field and clarify, whether it be on quarantine and isolation guidance, especially with the 3 different types of quarantine, like Brian mentioned, or whether it be just general information about COVID or some of the guidance for businesses. We did have a couple new establishments. I know I've mentioned them in the past, but 2 are open and running now. One is Five Guys at 115 Turnpike Street, and the other is Pita Time over in the 550 Turnpike Street Plaza. So those are open, so definitely go check them out. There's a couple other that are working on opening right now and are still kind of either in the building phase or kind of trying to fine tune some of the details to get up and running. Jet Nutrition is like a meal replacement shake style establishment that'll be in the plaza across the street from Town Hall on Main Street. J&M Market, they've been working on that for a while, and they're getting close to ready. So we're going to continue working with them. And then Bird and Wolf, I've talked about in the past. They're a restaurant that is still in the construction phase. They're over on Osgood Street near Princeton Properties. Like Brian said, we've been trying to put out a lot of information too. We've developed some PSAs, myself, Brian, and Kalechi. We had one for Thanksgiving that went out before the holiday. We had the phase 3 step 1 rollback that went into effect, I believe, on the 13th of December, just to try and give some added clarification to capacity reducements and other restrictions, like Brian mentioned, for example, on restaurants. There was also some stuff for gyms and offices that involved mask use being more restrictive. We have the Christmas PSA that has some information for that going out tomorrow, and then probably again next week. It's also permitting season, so we've been trying to get all the septic installers or inspectors who are renewing permits approved. We have awful haulers who are getting approved as well, and then the trash hauler, which is just kind of its own animal. We've been working on 2. Those are all due by the end of the year, so we're trying to get those up and going as much as we can. And other than that, yeah, it's been a lot of like Brian said, it's been quite hectic, to be honest, just with everything going on in the spike, but we're doing our best to just keep up with it and go from there.
Also, another restaurant that had reopened and not because of the virus is Panera Bread. They reopened the Saturday before last Saturday, or this past Saturday, after a driver lost control of the vehicle that she was driving and drove right through the front. So damage was done, but Panera Bread was right on top of the situation, only down for a couple of days. open again. Matter of fact, I've been there several times since the incident, and all is well at Panera Bread at this particular time. So most of you that are listening in are joining us right now at the meeting. It was quite an incident, but all is well at this particular time. And again, Panera Bread did a stellar job to reopen. So kudos to them.
Thanks. And just an update for Caroline. She's been doing obviously all the case management and contact tracing with our nurse partners. We do have a few part-time nurses working with us under contract to help with the Maven, the data input, the case management, and the contact tracing. And obviously we're working with the schools, businesses, restaurants, clubs, residents. We're getting calls and questions literally all day, every day from all of the above. Whether it's a question about their quarantine or their, little Johnny or little Jane's test results, what to do, or a kid in their school had it or thinks that they have it, they heard a rumor. So we're kind of like the clearinghouse for all of the what ifs and what do I do kind of questions. But Caroline's been working night and day, nonstop, 7 days a week. It's at the point where it's not unmanageable, but it's crazy. So I gave her the night off and told her to get some rest and pick back up at it tomorrow, and we'll go from there. But she is actually taking a few days off over the Christmas holiday. So we have some backup plans in place to manage her workload while she's getting some rest and relaxation over the holidays, which is good. Definitely well deserved, and she needs it. So I had one, her turn now, Steve's next, and then Tony, right?
Tony?
Oh,
All right, that sounds good. All right, back to you, Joe.
Yeah, before we turn it over to other members of the board to talk about the virus and the vaccine, I just wanted to quickly go over some highlights, certainly some national highlights concerning the vaccine. The total cases are 17 million, which is about 5% of the populace. And these are only cases that we know. Yeah, I'm sure the number is considerably higher than that. In new cases yesterday, 244,000. At this rate of infection, without the vaccine, the virus would not subside for at least 2 more years, and that's called herding. So with the vaccine, hopefully we'll be in pretty good shape by middle of next year. 10 million people have recovered nationally from the virus. The related deaths, 308,000. If you look at total deaths from all causes, no matter what, above and beyond the virus, taking a look at a Ruther fact sheet, last year in the United States, 2,900,689 people died. And so I asked myself, well, what, if any, effect is this vaccine going to have on deaths? And is this virus going to have on deaths? Well, the projected deaths this year nationally, for all reasons, are 2,818,527, which is less than last year. And we didn't have the virus last year. So, and I thought the number would be a lot higher than the coronavirus. Certainly the population this year was greater than last year, but the total number of deaths is projected to be lower. I'm perplexed by that, but I wanted to present it to you nevertheless. Maybe someone on the board or department can explain that, because I certainly can't do it. One of the conversations that Brian and I had this past week was the interpretation of the mandatory quarantine requirement for travelers arriving in Massachusetts, unless they're arriving from a low-risk state. I believe the only low-risk state right now is Hawaii. Now, there is a quarantine requirement for all other states, And also, or unless, of course, you have a negative COVID-19 test taken no longer than 72 hours before you arrive back in Massachusetts. So my question to Brian, and and I know the answer, but I'll let him talk a little bit about this. Say you shop at Best Buy in Salem, New Hampshire, or say attend a grandchild or a child's birthday party in New Hampshire. Would you have to be quarantined? And I read the Executive Order 46 about the quarantines, and I didn't see anything in there as such. And this is just not a hypothetical. If you take a look at all the border communities, New Hampshire, Massachusetts, that's where the big stores are, because people shop there for convenience, and a lot of people, they just don't want to pay the sales tax. So Brian, can you answer that?
Yes. So essentially, when they wrote the travel advisory, was for travel. That means not just going shopping 2 towns away, it's actually traveling. So it's written one way, it's intended for one purpose. And in discussions with DPH on conference calls and webinars, the interpretation is basically, if you go to dinner or you go shopping in Salem, New Hampshire, you don't have to quarantine when you come back. If you go away for the weekend and you spend a night in Salem, New Hampshire, friend's house, hotel, whatever, then you have to quarantine. So if it's an overnight trip, you're required to quarantine. If you go for a couple hours to hit a few stores for Christmas shopping, you don't have to quarantine. They even actually said that, and this is kind of funny, that if you have a second home in New Hampshire and you go there for the day but come home, you don't have to quarantine. But if you go to your second house in New Hampshire and stay over, then you have to quarantine when you come back. So I don't know how to enforce that, but that's the guidance, that's their travel advisory, and that's what they request. So if you go shopping, you're fine. If you go and stay overnight somewhere, then you need to test when you get back.
If you look at all these regulations, and the last I saw, I think there's like 56 regulations that the governor has put into place concerning the virus. And with few exceptions, they all start off legal terms, whereas, what if, et cetera, et cetera, et cetera. And then it gets to the nitty gritty, the meat. But there's not much meat in this Executive Order 45, because there were so many what if scenarios that simply are germane to us who live on the border of New Hampshire. And I know Steve even spoke with them too. And is Steve, when you spoke with the state, is that what they said to you, or did they say something else as far as how to interpret this Executive Order 45?
Can you repeat that, Joe, real quick? Sorry.
Yeah, you spoke with the state as far as how to interpret Executive Order 45, the quarantine, if you leave the state and come back to the state. Did they give you the same answer that Brian just gave us?
Yeah, for the most part, it was meant for more. I don't want to say traveling, because that's kind of a broad term, but I would say like overnight stays. I'd say like if you're going across, like Brian said, briefly to maybe shop and coming back, you don't need to.
Well, at least we have an answer right now that seems to be somewhat realistic anyway. Uh, I want to pass information along to certainly members of the board, and with the exception of me, and I'm a chemical engineer, other board members are either physicians or administrators or insurance carriers in the medical field. So we'll be hearing about the virus and vaccines from, at least I'd like to hear about the virus and vaccines from their personal and professional perspective. That is, hospital insurance carrier concerns, local distribution or logistics, fairness in deciding who gets the vaccine. As for me, the vaccine has hit my family. My brother has it and is recovering from home. My brother-in-law has it and is in an intensive care unit of a hospital. It's scary. But I'd like to start with the members of the board by seniority. Michelle, how's it been for you and your family and in the profession that you have? Because I know that you are a hospital administrator. So can you comment a little bit about the virus in this vaccine?
I no longer work in the hospital community, Joe, but I am working in the Medicare community. So doing a lot of work right now, obviously, with a Medicare population. Obviously, Medicare is going to be covering the vaccine for all of our members. So we are currently handling a lot of questions and concerns from our members about what phase they will be vaccinated, and a lot of trying to just figure that out, as well as right now my whole team is working remote, which is fine. But figuring out when we will, because we're not in a hospital environment or a primary care or anything like that, figuring out when we will be, what phase we will be vaccinated in, because my whole team works in South Carolina. So I have to be aware of what's going on, not in Massachusetts, but in South Carolina.
Wow. Wow, that's interesting. How about you, Daphne? Daphne,
I
are you
had to
there?
mute myself. I'm here. Hi.
Yeah.
Okay, can you hear me?
And how's
yeah.
it been from you dealing
Okay.
with this vaccine and the virus and et cetera, et cetera?
So, just like Michelle, I work for a health plan, and we are remote. We're fully remote until June, but we have been doing a lot of telehealth. So we do dual population, both Mass Health and Medicare. So they will be covered by those entities. But it's just been a lot of dealing with the physicians and stuff, because that's what my role involves. So it's just kind of, business has been different for us these past few months. We've been doing a lot of Zoom calls, a lot of telehealth, and we are excited to know that there is a vaccine, so that way we can get back to some type of normalcy. So we're just waiting to hear what the next steps are for us.
Interesting. And certainly last but not least, the two doctors that we have, Patrick Scanlon and Max Tilson. So starting with you, Patrick, how has it been out there? And what's your take? Tell us a little bit about the vaccine and what, if any, concerns you see.
So I got my first dose today. It was highly uneventful. They had me wait for 15 minutes after the injection. It was fine. It actually, I feel less pain, like I got punched in the arm, than when I got the flu shot. So it was very easy, with no issues whatsoever. I guess I'll probably, so I agree that the ICU admissions have definitely been less. Um, Hospitalizations are going up, like Brian said. ICU admissions have not been as severe, but they are certainly bumping up as well. The vaccine itself, basically what I've been telling my patients is it really truly is a medical miracle that they created these vaccines this quickly. They did not cut any corners whatsoever. I've also told my patients that the FDA is probably one of the strictest governing bodies in the world when it comes to medicines. There are plenty of medications that are approved in Europe that don't get approved in the United States because of the FDA. So if you got to get something through the FDA, you better have your facts and data together, and proving efficacy. And both of these vaccines, hands down, proved that they were effective. We were looking for only 60% effective, and the fact that they've produced over 90% efficacy is absolutely amazing. The side effects have been minimal. I think that the fact that things like allergic reactions and the few cases of Bell's palsy that came up are not statistically significant, but also, especially with allergic reactions, every single vaccine has that allergic reaction risk. And the reason why it's coming, it's more upfront on the news is because these vaccines are under a microscope because we're in the middle of a pandemic. But that has not um, deterred me whatsoever, and I've made it a point to talk to every single one of my patients to make sure that they get the vaccine. And I have changed a few minds of some of my patients so that they're going to get the vaccine. I think the biggest concern is the amount of people that will go back to get their second shot. Um, the data with looking at like the hepatitis B vaccine, the concern is that only about 50% of people who got the hepatitis, this was, I think it was a Harvard study that looked at the hepatitis B vaccine, only about 50% of patients came back within a timely manner to get the second hepatitis B vaccine. It's a total of 3. So the big concern is that patients need to go back within the range is like 17 to 21 days to have that second shot, because you're not going to be um, considered fully vaccinated against COVID-19 unless you have the second shot. And immunity takes effect 7 days after the second vaccine, where you're considered 90-95% immune.
Yeah, I had read that if you take just one shot, and you said some people will not be coming back, the effectiveness is about in the low 50s, about 53% or so. Um, on a lighter side, there's a Saturday Night Live skit this past week in which comedian Kate, I believe her last name is McKinnon played the role of Dr. Fauci. And a question that Dr. Fauci was asked is, what do you have to do to assure that people come back for their second shot? And he says, have people, particularly elderly people, if they get their shots at CVS and elsewhere, leave a piece of jewelry behind. And that guarantees that they'll be coming back. So there may be some merit to that skit. I don't know, but it was funny nevertheless. I have a question for you, Pat. The eligibility guidelines for the elderly with specific comorbidity conditions probably will be similar to the guidelines for the pneumococcal and the Shingrix vaccines. But I'm not sure. And I'm not even sure what a comorbidity problem is. For example, I've had open heart surgery twice. I've had cancer. Is that considered to be? I'm over 65. Is that considered to be comorbidity? So I just hope there's not a food fight with people that want to get the vaccine doing what they can to get the vaccine. I know that, for example, prisoners. They have groups of people that watch over them, protect them. A lot of people don't in the United States that work for themselves, carpenters, laborers, and plumbers, and so on and so forth. And getting back, if you want to get a shot and you're not sure if you're eligible, say if you have a comorbidity condition, how do you find out? How do you get in line? Can you answer that, Pat or Max?
So that's actually a really good question, and I actually think that maybe even like Brian may have a better answer than us, or Max if you do. Um, as far as comorbidities, you can certainly address that with your primary care doctor. The major comorbidities that we've talked about are heart disease. So, Joe, that would be you as well as over the age of 65. Um, but over the age of 65 is not necessarily a comorbidity. It's first with, you need underlying comorbidities like heart disease, diabetes, um, hypertension to a certain degree, COPD, which is a lung disease. Those are probably the big ones. Obesity is certainly probably the most documented risk factor for severe COVID that repeatedly comes up in the literature. But as far as how to regulate who gets the vaccine, because if you think about things like the zoster vaccine or the pneumococcal vaccine, that can come from that's a, for the most part, unless you go to a pharmacy, that's age related, and also discussing with your primary care doctor where you generate an order. There's not necessarily an order that's going to come for the COVID vaccine, an order from a physician. But so that's where I agree that a lot of patients have asked me the same question, and I don't have a clear answer as to how we're going to be able to divide out based on comorbidities. I don't know if Mac have a better answer for that.
So I don't. I know that I called the Department of Health in Lowell, because I work in an endoscopy center there and have an office there, and asked about what was going to happen to the patient-facing staff who worked in those facilities. And the Department of Public Health had no answer for me there. They said that probably they thought that the vaccine was going to be distributed through the pharmacies. And Brian, maybe you can comment about that, about how vaccine distribution through the pharmacies is going to happen at the CCRCs and retirement communities. But that was my answer for the people in Lowell. They really did not have a discrete answer about how they were going to differentiate and how they were going to prevent people from jumping queue and getting the vaccine ahead of someone who was otherwise more eligible for it.
Yeah,
Yeah,
I know, for example, as I mentioned, prisoners, they certainly have their advocates. Now I know that the cases of positive cases in prisons are higher than they are outside prisons. I'm aware of that, but the vaccine is here. And it appears that if you are in prison, you have advocates and you get the vaccine ahead of so many of us who didn't do anything wrong and are not in prison. And I have I don't know, I'm uncomfortable with that. I know that in some states like Colorado, the governor says, oh, no, the prisoners are not going to be in phase 1 or phase 2. But we'll see on that.
Joe, I think the risk there is it's just close proximity to one another, and just a high risk of transmission from a public health standpoint. Then it goes to the guards, to elderly prisoners. I think that the risk of high transmission rate is very high in the prison. I mean, that's where even cases like tuberculosis can be generated because of just such close proximity to one another.
Yeah, I understand that, and I certainly wouldn't have a problem for the guards having it, but I'm not comfortable with that, as so many other people are not. If you talk about proximity, 70+% of the cases are within one's home, friends and family. And I know in New York, they're shutting down, in the city, they're shutting down the indoor restaurants. And they said that only 1.4% of the cases of the virus have been related even remotely to the restaurants. So it's a mess right now. But as Brian said, fortunately, the vaccine is here. I believe the Moderna vaccine, if it hasn't been authorized by the FDA, excuse me, today will be authorized tomorrow. Correct me if I'm mistaken on that. And that's an interesting vaccine too. Although it's quite similar the way it as the Pfizer vaccine. If you take a look at the specifics, some of the research that they've done, the Moderna vaccine, has shown that it protects you, but also protects other people from you. And if you're talking about the vaccine, I mean, you can still, correct me if I'm mistaken, you can still get the virus, but with the vaccine, the antibodies go after it right away. And for 95% of the populace, it's no longer an issue of concern. And that for the other 5% of the populace that come down with the virus, it's a weakened. The majority of them, it's weakened. But nevertheless, things look really good right now, and it's just a matter of time before this problem is addressed once and for all.
So to answer your comorbidity
Thank you.
question, that's going to be probably up to the primary cares. I know that there are 3,000 vaccine providers registered with the state. We're one of them. We actually just re-registered for receiving COVID vaccine. I know that Patrick and Caroline and Melissa worked on that this past week and got that submitted. We got the approvals already, so we're good to go. We will help and do possibly, depending on, it's all kind of rolling out and being planned as it's being rolled out, which is kind of typical. But right now, all the vaccines being shipped out to providers that can vaccinate their staff. So hospitals, healthcare centers, people that are dealing with COVID positive facing patients. Long-term cares can also do their own, so they're going to get shipments soon too. From what I understand, it's not definite, but this is what I'm hearing, that long-term care facilities are absolutely high on the list because of the susceptible population they have and the issues that they've seen in the past. So the next phase, or into the end of phase one, we may be able to get vaccine to do our first responders. So we can do small little private clinics for police, fire, or EMS, things like that. So the comorbidities will be addressed probably through your primary care, or if you wait, if we do any general population or public clinics in phase two for 65 plus, say at the senior center or the high school again, or something like that, we'll kind of transition to that. So if you do have a comorbidity, I recommend that you check with your primary care, see if they're going to get it and when they're going to get it, and how to get on the list for them. We're not checking medical records and determining somebody's place in line. That's not how deep we go with this. We open up a clinic for certain populations, and that's that. So beyond that, I'm not sure unless you guys hear anything, let me know. But the comorbidities will be addressed through your primary care is my hunch and my suspicion.
Hey, Brian, I have a question for you.
Sure.
After you get your second vaccination, what does how does quarantines work after a vaccinated person is exposed to a COVID positive person?
That has not been published or put out there yet. I think we're concentrating on the vaccine first. My suspicion is if you get vaccinated, then you wouldn't have to quarantine, just like any other vaccine, and being able to go to school once you get your MMR and all that kind of stuff. So
Okay.
I'd be curious to find out if that changes, but I'm assuming that once you do get vaccinated, you won't have to quarantine. Just a guess.
Hey, Brian, can you also comment on what's the department's stand, or how are you going to follow people for the second round of vaccines? Are you going to you're going to administer the first and have a log and call them back for their second one? Or do you own those people once you give them the first, or how does that work for you guys?
We would have to create some sort of log or even secondary appointment at that time. So if we get 500 vaccines, schedule 500 people, whether it's police or fire or maybe 65 plus, or for that stage, schedule it. They come in, you have the information, and then you reschedule them at that time. Hopefully we'll have an idea as to when we get another shipment in. So if we get Pfizer in, which I'm assuming it's going to be Moderna because of the storage requirements, we'll get 500 in, schedule it, do the 500, knowing we're going to get another 500 in 15 days. Schedule the next 500 or the same 500 for the second shot in 16 days or something along those lines.
So will you bank? So when the second dose, I mean, obviously it's a lot of shifting, but will you bank the second dose of vaccines then? So if you get a 500 vials in 2 weeks, those are already spoken for, correct?
Yes. What we would do is we would give, if we get 500 in on day one, and then another 500 in on day 15, we'll schedule the same 500 people on day one and day 16. So we wouldn't hold any back because of the storage requirements. And I'm trying to remember what the Moderna storage requirements are, how long you can keep it in a regular refrigerator before it goes bad.
I had read many months, but then again, I've read a lot, and I'm really not quite sure.
I forget. I was talking with some of my colleagues yesterday about this, and we assume the Pfizer is going to go to the places that have cold storage. Moderna will go to other places that only have regular refrigeration.
And for those that are listening in, if you want additional information, a great source is the town's online website. So, say if you're elderly, you want to know more about getting a vaccine, go to the website, speak with your primary care physician, and of course, speak to Brian and Caroline in our Department of Health. Max,
Actually, a couple questions I've gotten this week. I know Steve and Pat talked earlier about the immunity for people that have had it, and we're getting obviously different, not rumors, but we're hearing different things from various groups as to how long people are immune, what the situation is, do they need a vaccine? And I know you sent some articles out today. I didn't get a chance to take a look at them yet. Will you just give us a brief rundown as to what that is?
So, bottom line, if you got the virus, you've been infected with the virus, or you've tested positive, you still should absolutely get the vaccine. The articles that I sent out, basically the bottom line is we truly don't know how effective, how long your immunity is after you've been infected with COVID-19. The data really ranges anywhere from 3 months to potentially longer, well over a year.
So
And
after we
MERS.
get our 2 vaccinations, we may have to repeat that again in 90 days or a year or a little bit longer than a year.
No, we're
No,
talking about
so
people that. Go ahead, Pat.
yeah, we're talking about people who are infected. The vaccine, the data is actually better. I actually saw a study that said that you can potentially generate immunity for up to 3 years with the vaccine. But the bigger question was whether or not people who were infected with COVID-19 or tested positive, should they get the vaccine? And that answer is definitely yes. Max, also please chime in at any point. But a lot of the studies are looking at a more kind of based on what the SARS pandemic or epidemic was, and MERS, the Middle Eastern respiratory virus. Both of them are subtypes of coronavirus. They're beta coronaviruses, and that's what COVID-19 is. So that's where all these studies are mainly looking at, because COVID-19 is brand new to us. So we don't know what it truly is going to generate. But it basically comes down to is if you are sick enough that you're in the intensive care unit requiring oxygen supplementation, significant oxygen supplementation, or you are critically ill, you're going to have a longer immunity. But as far as how long that immunity is, it's maybe up to a year, but that might be saying too much. But minor symptoms, maybe a few months. So really, it comes down to is number one, we truly don't know, but that's even a bigger reason to say everybody needs to get the vaccine, because the vaccine trains your immune system in a different way and goes after different cells in your immune system to train it, to trick it. You're basically tricking your immune system to thinking you have COVID-19, and you're activating certain cells within the immune system that have a longer memory than if you were infected. And that's why you're able to generate a longer immunity with the vaccine. As far as booster shots, we don't know yet. I think we're just trying to get past the pandemic stage. And then, hey, if it's a booster like we get the flu shot every year, then that's fine. We don't get a flu shot every year as a booster. We get it because the influenza virus mutates. The coronavirus does not mutate, which is another common misconception that's been out there too.
Okay, that's good to know. I'm also getting questions. Our biggest thing right now is family clusters. We have them all over town. I know a few families that are all quarantined or they're isolating because they actually have it, and they're asking me what should they do, like, to take care of themselves. somebody said they're not supposed to take Advil, but I wasn't sure if that's true or not.
Max, you want this one?
Yeah, I mean, so when this all started back in March, there was a lot of initial publicity about the use of NSAIDs and Advil for fever suppression. So, Pat, I mean, I have that's what I have seen confirmed, and I haven't seen anything beyond that. I know people have still used it for fever suppression, but from what I understand, it's not the drug that I would reach for first.
I think Tylenol is still probably the drug of choice. I think ibuprofen is okay. Tylenol is probably the drug of choice, but there was also way back when the pandemic was first starting, there was also a risk of patients on ACE inhibitors, things like lisinopril, that it increased mortality if you were on that, and that has since been debunked because it just comes down to the way the virus was entering the cells and followed a similar channel. But that was also debunked as well. We have given ibuprofen to COVID-19 patients without significant side effects, but I would still go with Tylenol as the drug of choice for fevers.
Okay. And somebody asked me about zinc. They think I'm a doctor sometimes. I'm like, should I take zinc? I go, I have no idea.
You know what? It's just, I mean, there's no data. Again, kind of medicine is a very data-driven field, obviously.
Yep.
The other question is probably vitamin D too. There, there's a little bit more compelling data, but nothing that's statistically significant or would alter treatment. I think vitamin D happens to be a very good vitamin to take because just a product of being in the Northeast, we are
Yep.
all deficient in vitamin D anyway. So
Yep.
I don't discourage that whatsoever. But other things, I have not really seen any significant benefit.
Yeah, it's just my friends like text me like, what should I do? What should I take?
Nothing, time, and
Plenty of liquids, eat
yeah,
healthy,
hydrate,
get
stay
rest.
hydrated, and get rest. And
All right, so
you know, lucky enough, for the most part, it's a typical cold, but it's that small population that just it hits people hard, and it really is just astounding on what it does to the respiratory system for a small population with risk factors.
wow.
I would also add that the one of the risks of the young people getting the virus is that they feel pretty good, and then if they're sort of health conscious or athletes, they'll go out and exercise pretty vigorously. And there's been some data about the cardiotoxicities of the virus as well, and that it can lead to pretty significant heart damage to people who exercise while they are actively infected. So people who have a tendency to go out and want to exercise, they should hold off on that for a couple of weeks after they've had after they've been infected.
Okay. All right. That's good to know. Thank you.
As Brian said earlier, it's in excess of 6% of the people that are tested have positive test results on a 7-day average. And a question primarily to the doctors. Let's say you have a positive test result for the virus, and obviously you're going to have to be quarantined. At what point should you, if at all, see a primary care physician? And I say that because my brother-in-law, who had a positive test results, didn't do anything about it. And then he was taken by ambulance to a hospital. So at what point should you contact your primary care physician? Can you give us some guidance, some guidelines here?
I think that most primary care, so number one, you will never be able to go in to see your primary care doctor if you're positive for COVID, but the availability of telehealth, to be able to telehealth into your primary care doctor to schedule an appointment. I really, number one, shortness of breath. If you're feeling shortness of breath, you need to contact your primary care doctor. Um, Other symptoms like persistent fevers that are not responsive to things like Tylenol, that's probably another big factor, or just your comfort level. If you feel uncomfortable with anything, the way technology is, you can easily call or do a telehealth visit with your primary care doctor, that you can address their concerns to him or her at any point. And that's probably my biggest thing is if you have any concerns or questions, all you have to do is just schedule a telehealth visit with your primary care doctor.
Okay. Anyone else? Max, we may have cut you off once. We may have cut you off once or twice, Max. I apologize, but
Yeah,
do
me too.
you have anything further to say?
No, that's fine. I mean, I think that one of the, so you asked how we've been, how people have been affected personally by this virus, and one of the things that I do as a gastroenterologist is screening procedures like colonoscopies and upper endoscopies, looking for colon polyps and Barrett's esophagus. And when the state came out with the state came out and restricted elective procedures, specifically geared towards things that were non-emergent, so things that could wait for a couple of months. And they carved out a very small niche for procedures that were preventative in medicine. So those are things like colonoscopies and upper endoscopies, screening for underlying conditions. I would strongly encourage people who have hypertension to not avoid getting their blood pressure checked, who have high cholesterol for not get to continue to get their cholesterol checked and managed, because those issues, if you leave them to lie too long without getting treated, can lead to really significant problems later on. We saw that in March when people were really skittish about this and didn't know what we were dealing with quite as much and didn't see people. There were undetected cancers and there were consequences of untreated hypertension and high cholesterol. So that's the first thing. The second thing I would say is that in Lawrence, while we would have been allowed to do those carve out screening procedures at the hospital in Lawrence, because of the rate of COVID infections in the hospital, they've had to repurpose the staff from the surgical and endoscopy units so that those procedures aren't available there at the hospital right now, because the hospital is so inundated with people who fortunately aren't being treated by PAT, but are being treated by the nurses on the regular floor. So people who have mild oxygen requirements or something like that, the hospital is quite full with people who have moderate disease but are able to avoid the intensive care unit. So those are the only things I would add to this pretty vibrant discussion, is that it's important for people to not be too scared to contact their primary care doctor, and certainly not be scared about and avoid treating their preventive medicine and other chronic health problems, which are going to get a lot worse if they're left alone.
That's interesting. As you know, I've had colon cancer, and those of us, and by the way, recovery was just bloody awful. I was just so sick for over half a year. But those of us that have recovered, we have to have a colonoscopy. They say about every 3 years, whereas the populace, certainly the elderly, is every 5 years. Correct me if I'm mistaken. So, is that considered to be, you say, an elective surgery right now, a colonoscopy, even for people like me that need it?
No, it is not. So that's one of the carve outs I was talking about, Joe.
Okay, I wasn't quite sure. I wanted you to clarify that. Thank you.
Yeah,
okay.
that's one of the carve outs I was talking about, that the governor said, because what they found is that there were 20,000 missed cancer diagnoses per month back in the early time of this epidemic, when people didn't get screened for things like breast cancer or like colon cancer or like cervical cancer, because of missed opportunities to screen them. So there were 20,000 per month cancers that were missed or delayed in treatment because of that. And they just want to avoid that this time.
Okay, yeah, I wasn't quite sure what you meant at first when you said carve out. So now I understand. Thank you. Thank you very much. Anything else? Feedback, comments, additions?
Max, when are you getting your vaccine?
At 11:15 tomorrow.
Ah, there you go.
Yeah,
Excellent.
pretty psyched.
Lowell General or Lawrence?
Over in Lowell.
Okay.
Now I know some people that are getting their vaccines. They've been told not to go back to work the next day. Like my daughter, one of my daughters, for example. She's in the medical field, and is that what you're seeing too?
So Joe, I can tell you what came out from the hospitals is that if you can, because there are some people who develop, the same sort of, they develop problems with feeling tired or sore, if you can, maybe schedule it on a day that you're not going to work for the next day, but it's certainly not, don't plan on missing work the next day. The vast
Well-
majority of people who get this vaccine do just fine with no problems.
Good point. Anything else?
I think that wraps it up, Joe.
Then I need a motion.
Y'all give a motion to adjourn.
Is there a
I
second?
second that motion.
Thanks, Daphne.
All that,
You're
all
welcome.
those in favor? All those in favor say aye.
I
Aye.
Those
Aye.
opposed? Those opposed say no? Or noes? Motion is approved. Meeting's adjourned.